Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about attention deficit hyperactivity disorder, ADHD. Here's the plan that we will follow during the presentation. ADHD definition, predisposing factor, epidemiology, ADHD in children, ADHD in adulthood, symptom, physical examination, differential, and treatment. Our attention has never been more scattered than it is today. Our brain finds it difficult to multitask. However, we are obliged to act in an effective and efficient manner, despite an environment that tries to scatter and disperse us. Hyperfocus provides in-depth information on how to best support yourself and constantly direct your attention to a meaningful, useful, and productive goal. What if you are hyperactive? In children, problem paying attention may result in poor school performance. Although it causes impairment, particularly in modern society, many people with ADHD can have sustained attention for tasks they find interesting or rewarding. As a definition, it starts before the age of 7 and symptoms at least 6 months. Hyperactivity, inattention, and impulsivity, and the whole lead for the decrease of social and academic function. Despite being the most commonly studied and diagnosed, the precise causes are unknown. Genetic factors are estimated to make up about 75% of the risk. Nicotine exposure during pregnancy may be an environmental risk, and it does not appear to be related to the style and parenting or discipline. It affects about 5 to 7% of children, and it is diagnosed approximately 2 times more often in boys than in girls. About 30 to 50% of people diagnosed in childhood continue to have symptoms in adulthood. Between 2 to 5% of adults have the condition. In adults, inner restlessness rather than hyperactivity may occur. Adults often develop coping skills. Let's move on to symptoms. Short attention span, constant fidgeting, inability to sit through cartoon or mail, inability to write in line, failure to stay quiet or sit still in class, disobedience, shunning by peers, fighting, poor academic performance, carelessness, poor relationship with siblings, short attention span, disobedience. Hyperactivity. Physical examination, perceptual motor problem, and incoordination are sometimes present. IQ tests and symptom rating scale are used by teacher and parent. Differential, age appropriate behavior, response to environmental problems like divorce, moving away from the home, mental retardation, autistic disorder, and mood disorder. Repetitive behavior. Think about autistic. Treatment. Define target symptoms before initiating treatment. Treatment include psychological, social, and educational intervention. Increase structure and stability to home and school environment. Short and frequently repeated education. Reinforcement for learning. Minimum distraction. Psychological, social, and educational intervention, but you have to put the target first. In matter of education, use frequency, repetition, and less distraction. Psychostimulant like methylphenidate, modafinil is not addicting. Neuromedication like atomoxetine, but you have to reassess frequently to see if medication are still needed. We can use other medication like antidepressant. I would like to finish with this optimistic note. The brain has two powerful modes that must be uncloaked to use his attention effectively. A focused mode, which is the basis of a highly productive task. Concentrate deeply, think clearly, work your life deliberately. And the second is a creative mode, which connects ideas effectively. Identity and manage distraction and interruption. Establish a clear physical and mental environment in which to work. Control motivation and work fewer hours to become more productive. Take time out with intention. Adopt a multitasking strategy. Learn when to pay attention and when to let your mind roam free. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.